CT scan is amazing because it gives us a three-dimensional picture of a jaw and of teeth. It shows us where we can place implants without jeopardizing the nerves or the sinuses. It can find an extra canal in a tooth when we're doing a root canal. It's just phenomenal. Patients love it because they can just sit with me and go over everything and they can see it three-dimensionally. I mean, not too many people can read an x-ray, but you give them a three-dimensional object and they get it. And it's just really a cool way to look at things. With the 3D imaging, you can predict and plan precisely where you want to place an implant. It's just foolproof. So it makes it so that every placement is going to be successful because you're not going to be jeopardizing the adjacent tooth. You're not going to jeopardize a nerve canal. You're going to know if you need to do a bone graft or not a bone graft. So it just enhances the predictability of a case. There's no surprises.